know we've talked about bringing a laser into our office, so I'm going to do a brief introduction of what that looks like. So some of the learning objectives today, we're going to understand the fundamentals of the laser physics and tissue interaction. We're going to explore the clinical applications of the laser in the hygiene department specifically. We're going to discuss the diode laser technology on soft and hard tissue. And then we're going to review the laser safety and then overview LVR, LAPT, and PDM. Explain what those abbreviations mean. So introduction. So laser stands for light amplification by stimulated emission of radiation. The first laser was developed in 1960. It's called the ruby laser. It wasn't until 1990 that the first laser was designed for dentistry. And then the FDA didn't approve lasers until 1997. So they've been around a while. Some of the most popular types of lasers is going to be a diode laser, that's what I have here, and then a CO2 laser, and the ER YAG, the ND YAG. The diode laser is kind of the lower setting one. It's 810 to 980 nanometer wavelength. It's most often used for soft tissue management and hygiene. And then the CO2 is a bit stronger. You can use it for soft tissue surgery, such as like frenectomies, gingivectomies. And then the ER YAG is even stronger, and that's used for hard and soft tissue. So it can remove like caries, it can cut into bone, and they use it for like SRP adjunct therapy. And then the ND YAG is soft tissue periotherapy. They do pocket decontamination, and it's great for like pigmented tissues. So the laser physics and the tissue interaction, the way that it interacts with the tissue. So absorption, this is the most critical interaction. The tissue absorbs the laser energy and converts it into heat within the tissue. Each laser absorbs different wavelengths, and then so for soft tissues, like for gums, it absorbs the energy, like the diode and the CO2. And that's when it's good for the pigmented skin, like melanin and the hemoglobin. And then hard tissue is enamel, bone. It absorbs the energy from the ER YAG lasers, which is absorbed by water and hydroxyapatite. And then the reflection, that's when the laser bounces off the tissue. So I really like that picture because it kind of shows like how it penetrates, and then the reflection kind of got cut off. But so it reflects off the tissue, doesn't really have much interaction. And then the transmission is when it passes through the tissue without interaction. This doesn't help the treatment, and it's typically minimized. And then scatter radiation. It's pretty self-explanatory, I think. But the laser energy, it might be scattered inside of the tissue, like that image, it kind of spreads out, going in different directions, which can...
Is that one bad because it doesn't get where you want it to go?
Exactly.
Okay, gotcha.
Yeah. So it reduces the precision. And then what happens when the energy is absorbed? So depending on the power and the duration of the laser, the tissue may undergo what's called photothermal effect, which is when the heat causes the cutting and the coagulation. So it helps stop the bleeding, which is good in some cases, right? The photoacoustic effect, this is when the energy creates shock waves that break up hard tissue and disrupt the bacteria. And then the photochemical effect is used in procedures like the photobiomodulation, which is like red light therapy. And we'll go into that in more detail. So the roles of the laser in the dental office. So for soft tissue procedures, the LBR, laser bacterial reduction, LAPT, which is laser assisted periotherapy. You can use it for like lesion treatments, like cold sores, ulcers, things of that nature, frenectomies, gingivectomies, and even crown lengthening. The benefit is it's a non-invasive with minimal bleeding. It reduces the post-operative discomfort, like from extractions and such, and then promotes faster healing. And then for the hard tissue, desensitized exposed dentin. Some lasers can even cut the enamel and dentin without a drill. Like the ER does that. And then the photobiomodulation, that's for the red light therapy for TMJ treatment. It'll help reduce any like jaw pain, mucotitis, sinusitis, salivary stimulation. It'll even promote like movement with orthodontic treatment, which is cool. It'll promote nerve regeneration, and you can help treat perioimplantitis. And then here's some images, a little zoomed in. That's actually a model of this laser here. This is the photobiomodulation image. So utilizing it in the hygiene department specifically, hygienists can only use it for soft tissue procedures. So that LBR, the laser bacterial reduction, the periotherapy, the hepatic lesions, and then PBM. And then some of the therapeutic advantages, again, minimally invasive, reduces the trauma to their surrounding tissues. It causes less pain and discomfort following procedures. You can even, in some cases, not all, but it'll reduce the need for anesthesia. It helps reduce the bleeding and the swelling, so it cauterizes the blood vessels, minimizes the post-op inflammation, and then again, faster healing and recovery. So it promotes the tissue regeneration and shortens the downtime after procedures, which is super beneficial. So the cycle of inflammation, so it begins as little single floating bacteria, and then it lands and attaches here in this image, and then it matures into this lovely biofilm, and then this process is when it disperses and has the ability to kind of attach to other areas in the mouth. Obviously that's not ideal. This is just kind of a closer up picture of that. I was like, where's my video? So originally I was going to do like a hands-on and show you guys how to do it. However, the lady that let me borrow this is out of state and she was not able to show me how to use it. And so I didn't, I've used other lasers, not this one in particular, so I didn't want to do all that. So I added a video on here kind of showing what the procedure of the LBR looks like. You can kind of think of it as like how we do the 30-second pre-rinse here with Closies. Same kind of thing with the LBR, except you're using the laser to do that, so it helps reduce the bacteria before you start instrumenting. Let's see if this plays. It doesn't play. Neither does this one. Probably because it's on. Okay, well that's really sad.
If you exit out, is it on Google, on PowerPoint?
So it wouldn't play on PowerPoint for some reason.
It was originally PowerPoint, but we changed
So
it
it's
to
on
Google
Google Docs.
Slides or Google Docs.
How long does it take you to do that? And it is supposed to be.
So the LBR is really quick. So you just kind of run it through underneath the gums. Exactly. It's kind of like a
Or you
catatron.
can almost carry it over. You just kind of drop it in the pocket and run it along.
Exactly.
Oh, super cool.
So it's really good at reducing the risk of bacteremia caused by instrumentation. So again, doing it before you instrument so that you're not moving that bacteria around to other areas of the mouth. That's where it prevents the cross-contamination, and it also helps reduce the aerosols caused by the ultrasonic. So yeah, I'm sad that I can't show you that video. And another video on this slide too. So this is where we would integrate it into like SRP cleanings for the gum therapy. The laser assisted periodontal therapy. So it's non-surgical therapy. It's used for root debridement, so it removes the biofilm from the hard tooth surface. And then the laser decontamination, it removes the biofilm within the necrotic tissue. So this is when the tip gets activated inside the pocket. You can literally see the tissue come off on the tip. It's really gross but cool at the same time.
Some smoke comes up.
Yes, the plume. So reduces the bacteria and biofilm that may have migrated into the gingival wall. So this helps promote the healing, and it allows us to reach deeper into the pocket. So you're getting rid of some of that diseased tissue, so you're able to get into healthier tissue. Oh, there's the video. It's a really cool animated video. You can't see it. Here. So lesion treatment. So this image here is an ulcer. I've got some canker sores, some cold sores.
Nasty.
So this works by destroying the viral particles and inactivates the lesions. So it cuts down the healing time on the process of the lesion. Benefits, quick and non-invasive procedure. It just feels like I've had this done before on myself. It just feels like warmth. It's not painful at all. Not at all. It also will help reduce the recurrence of them, so that's really, really beneficial to some patients who are really prone to them. There's a cool video to watch, but it's not going to play. Photobiomodulation, so the PBM. This is pain management for TMJ, so it'll help reduce post-operative discomfort following dental treatments such as orthodontic adjustments, extractions, and TMJ issues. It accelerates the healing, so promotes faster healing through the biostimulation. It'll help reduce inflammation. And there's a cool video there too.
Why is she so serious? She must hate her life.
She looks very unimpressed.
I was like, wow.
So that also helps with treatment of the lesions and then the tissue regeneration like we already talked about.
That spray tan gotta go though.
So this is the diode laser. Certain states require other, like Utah, I think, is only CO2 lasers. They can't use diode.
Really?
Yeah, Colorado doesn't use diode. So it's really state specific. But the diode laser in particular emits energy in the infrared spectrum. So the tip is red. And it's ideal for the soft tissue procedures. It absorbs into the pigmented tissues such as melanin and hemoglobin. We already talked about that. So it'll produce a continuous or a pulse beam. So continuous is for LVR, the bacterial reduction, and then the pulse is for LAPT when you're doing SRP. Comes with like little, I'm gonna pass this around those who haven't seen this, but there's a fiber optic tip on this, and that's what goes underneath the gums. And then the energy causes a photothermal effect, the heat. That's when it converts it into heat and vaporizes the soft tissue or kills the bacteria, depending on the procedure. So LVR or LAPT, depending on what you're using it for. And then some of the safety regulations. So the use of dental lasers is regulated by several state and federal agencies. The FDA it helps approve the lasers for use on hard and soft tissues. They're the organization that ensures the safety, effectiveness, and proper labeling of the lasers. The American National Standards Institute, ANSI, develops the laser safety standards for laser classification and signage. And then OSHA adopts those regulations that they set in place. And then they're also the ones that require the designation of a laser safety officer. So anytime you have a laser in the office, you have to have a laser safety officer. And I'll go into detail about what those do. And then OSHA, of course, we all know what OSHA does. But as far as laser goes, they enforce the workplace safety. like the protocols set in place for the lasers. They monitor hazards like the airborne contaminants. They monitor or mandate the eye protection and electrical safety. And then again, each state dental board has their own requirements as far as what type and who can use it and at what extent. And then the ADA, the American Dental Association, offers guidance and continuing education on the lasers. And then the ALD provides certification and promotes the safe, effective use of the lasers. So the laser safety officer, the responsibilities are educating the office on the safe use of the laser. They enforce the safety practices, such as making sure that the laser in use sign is posted when the laser is in use. They make sure that the high vac suction is being properly used. And then of course, proper setup and tip selection based on the procedure that's being done. They also keep a detailed record of safety audits, incident reports, training logs, equipment maintenance, things of those nature. They also ensure documentation is readily available for inspections and audits. And they oversee the personal protective wear, so I'm just making sure everybody's in the rooms wearing them. And of course, the laser maintenance, beam alignment, and the calibration. So that laser safety sign that I was just talking about, that's what that looks like. But when it comes to the safety glasses, each type of laser has different glasses that go with each one.
So if we got those for hygienists, would we just have to post that little sign, like?
Yeah, you just put it
outside
outside your door.
Yep, outside the door, so
You
that
just
way.
kinda set it on the floor or something outside your room.
Yeah, just so they can see it. And it's to prevent people entering the room on accident without having eye protective. So these have to be worn by everybody in the room. So me, the patient, everybody in the room has to wear them. These protect against scatter radiation. And then to clean them, you can only use soap and water. And then the wavelength of the glasses must match the wavelength of the laser. So some of those lasers, when you're using them for cutting bone and hard tissue, you might have to change out the glasses. I was looking at these. They are noted, like at the top, what nanometer it is. So these are, I think this one is for hygiene, it says, yeah. So just making sure that everybody checks that so that you're not wearing the wrong glasses. And then again, the laser sign. So this one doesn't, I could not find the one that has the actual requirements on it, but the sign is supposed to have the classification of the laser, the type of laser, and then of course the warning sign, the appropriate laser sign. This is just the one that I could find. And then the high vac system. So when you're using the laser, there's like a smoke plume that's created, so we have to have the high vac to kind of suck that out. There's also fun stuff like tissue debris that in there. And that is basically it. Any questions? No?